Welcome to It's Not Just Business Talks with Sonja, where we get down to the real business of how great leaders dug through their own trenches and climbed some epic mountains to get where they are today. Now let's get started with the show.
I'm here today with Dr. Ravi Komatireddy. I'm going to add your alphabet soup since you have it, MD, MCTI, and he is a physician and digital health entrepreneur who is currently the founder and CEO of Motiv Health, Inc., a startup passionately focused on using human and AI coaching for health behavior and change and prevention. I think you could say that either way. He is an internal medicine physician who trained at Dartmouth-Hitchcock Medical Center, Dartmouth, England?
Dartmouth, New Hampshire.
Dartmouth, New Hampshire, and the University of California, San Diego. Additionally, he was the first wireless digital health scholar at the Scripps Translational Science Institute, where he earned a master's in clinical translational investigation with a focus on digital health innovation. Holy macaroni is what I have to say about that. That's why I had to add the alphabet soup, doctor, because it was like, well, there is just a lot in there. Wow. So, okay, wait, where Dartmouth, New Hampshire, is that where you grew up? Is that where you started this long journey, or how did you end up there?
My journey started, no, I am from the Midwest, proudly from the Midwest.
Excellent. So which part?
Missouri.
Oh, Missouri.
So grew up a little bit in New York and the suburbs of Chicago, but spent most of my time in the Midwest. And not St. Louis or Kansas City, but a smaller town. So Columbia, Missouri, which is the home of the big university there. So it was great. It was a little bit of everything. It was a mix of Walmart and academia, in the same 3 square blocks, right?
Wow, entertaining, interesting, culturally cross section of Walmart and academia. I love it.
Right. Yeah. Exactly. Very interesting. That's the word for it, for sure. And
so, big family. Did you grow up there with brothers and sisters, or were you kind of isolated in that part of the world, or? I mean, my husband's from Missouri, so I'm kind of familiar with, that there was a lot of fields and chickens and farms for where he grew up. Is that kind of the life that you led, or was it really in town, city guy?
Town. Yeah. Fields and chickens were, probably 20, 30 minutes away, but we never really did that. So we were lucky. I had one sister, and we both grew up in a very supportive family in a really cool community. So it was, you have a town. The thing about university towns is that by their very nature, they're just extremely diverse. You've got people from all these different backgrounds and who have high-level degrees in training, and then they have kids. And so you end up hanging out with their kids, and all the other kids doing other stuff in the town. So it's a pretty mixed group. I remember that Friday Night Lights view of the American high school. We didn't have that. Like, our high school was very different. It was not the Cobra Kai people in little cliques getting into fights. It was everybody was surprisingly just like, oh, cool, okay, you're into whatever, your D&D stuff. Cool, all right, that's cool, we get that. And then you're in like your skateboarding crowd. You're like, oh, that's cool. Everyone was just kind of accepted. So it was a very unique situation.
Almost unheard of, actually, for schools. I mean, maybe it was that generation too, but I would say that maybe it's that area, because my husband reports the same sort of just everybody just goes outside and they get on their bikes and they ride around and they do their thing, and totally accepting of little kids, older kids, all just getting together. Maybe it's the culture in that environment. In that
it is. And then geography matters a lot, right? So you're in the middle of these 2 big cities, Kansas City and St. Louis, which means that any awesome band, and we're talking like 90s grunge phase, right? All awesome bands traveling on their tour from St. Louis, Kansas City, or vice versa, are going to go through there and hit this university town that's full of 40,000 students or whatnot. So it's just, you really did get a cross section of what was going on in the country, right? So it wasn't just like, oh, there's California doing cool stuff and New York kids doing cool stuff. It was like, no, you actually got a taste of all that because you were in a college town. I really appreciate that now more than I did back then, right? Back then, you're just like, can't wait to get out of here.
Well, which is probably that's every kid everywhere, right? You always want to get out. We were just talking about your wife. You're in Ireland right now, and it's gorgeous and charming, and the rest of us listening are thinking this is just so delightful and magical, and yet having grown up there, she's saying, ready to go home. Get out of here. Is that, or is she loving it and you're ready to go home?
No, I think the once you get a taste, it's like this is the problem with knowledge and this is the problem with diversity, right? It's because you get actually this once you open the spice rack and you had a taste of what things can taste like that aren't salt and pepper, and there'll be other things in that rack, you're like, oh, where'd that come from? And now your ambition starts to grow. And then you get quickly frustrated when you match your ambition with where you grow up. And that's probably true for a lot of places. If you grow up in Manhattan, maybe that's not true. But in most places, your ambitions quickly outgrow what's available to you in your town. And I think it's pretty natural. So Ireland is an island, and it's one of those places where there's a lot of homogeneity in the culture. And also, I think culturally, it's very much an island full of really nice people.
Yeah.
I mean, if we skip their whole Civil War thing, but for the most part, it's like everyone's really accepting, and it's very much like you don't want to stand out, do you? Like, why are you showing off? It's kind of like that. Like, there's a cultural check and balance in place, and in some ways, I think the United States is very much the opposite. It's like, go show off, be boastful, in some ways, our culture accentuates those traits and those natural tendencies that we have to be different, to stand out, to go the 110%. And there are real costs to that. We've seen those costs now as we've been more and more attuned to the mental health problems that we're all having. We see that there are real costs to doing that. But it's just kind of ingrained in the American way. There's something about like, go stake your land, go build the billion-dollar business, go for it, go try it, stand out, make a name for yourself. That's not the Irish way. Now, there's probably a bunch of Irish people on this podcast like, that's not true. You're mischaracterizing us. Maybe. It's just the feeling my wife had. And then she's like, oh, I want to go to
No, I would agree. And I have colleagues in the agency world actually that are in Ireland, and we have a couple of clients in Ireland. And I would say that just culturally, and I mean, I can't say that those three represent the entirety of Ireland, but they're humble, a little bit bashful in terms of, they may be excellent at what they do, but they may just be a little softer about. They're not brazen, and you identified me. I think that's the word, not scrappy, but brazen. That's me. We were talking about how I'm a bit of a strong-willed, stubborn, scrappy lady. But yeah, the Irish, they are very gentle and they're very kind and sweet overall, unless they're unless they're fighting a civil war, and then they're not sweet.
That's like Indians, right? It's I'm going to misquote this, but it was either Nehru or Gandhi was saying, like, Indians are horrible when they're violent because they're just really bad at it. So it's like when they do get mad, it gets really bad. And it's probably something similar to it. And I think coming from a family my parents are both immigrants from India as well, that was, and I've had this conversation, it's a fascinating conversation to have with your immigrant parents, which is something when you're younger, you'd never imagine having. Like, this is weird. When I'm older now, I have these conversations like, Dad, why'd you come over here? And he'll just tell you. He's like, yeah, there's stuff happening over here. And I wanted to be part of that stuff that was happening. And over there, there was less opportunity. And that's cool. For all the parts of the United States, especially now we're recording this on January 7th. So after all the stuff with January 6th, all this divisive stuff going on, it's like, I look to those qualities of what people describe, especially immigrants. They're like the most fiercely patriotic people, aren't they?
Oh my gosh, you're nailing that, right? Yes.
Yeah. I looked at what they see to calm me down about the United States. Oh, it's not that. It's actually, we have lots of good traits, and people are actually pretty nice. And I get asked sometimes, like, oh, is it really racist in Missouri? I'm like, no. Like, I've never, and I've never experienced that, to what I can detect ever.
Good for you.
In Missouri. So it's not most people, I think, are really nice.
This country is actually pretty good. My daughter, one of my kids and I had this conversation, and I bless her heart. I mean, I have 6 kids in college, and they're in that process, asking a lot of questions, thinking things through, and they're vulnerable, and through having being through this COVID era, right? It's a little bit it's a challenge if you're in college, but we have an American flag. But we also, and she asked us, she said it kind of represents hate now, to a lot of people. And I said, no, actually, like I gave her my immigrant story and why it actually really matters to me. But then we acquiesced, and we also bought our Pride we've got a pride flag, we got a Swedish flag, a German flag, a Scottish flag, and a Seahawks flag. So now we have all the flags, but we didn't take down the American flag because, you know what, there are a lot of good things about this country.
There are. So it's like you basically, your house looks like an embassy outside.
It does. It's the U.S. Embassy. We have my husband, and we have the poles, and these are not small poles either. And so, yeah, but you know, when you've got 6 kids, you kind of try to have to make some compromises and adjustments.
It seems like with 6 kids, your house is full of lively discussion for like the last 20 years.
And yelling and hunger. It feels like we don't have them. They're all gone. But when COVID happened, we downsized into a little house, and then COVID happened, and then they all came home, and so we had them. You know, do you know the old days when you had to have like a curtain in a room to like divide whose half of the room it was, and we had people on couches and in the garage, and it was nuts. But yeah, we have a very lively, wonderful group of questioning, diverse children, and that's what we want. That's cool. You know? But so let me ask you a question. Scripps, California, is that where you went to get your master's degree?
Scripps Research Institute is right. It's in San Diego, California.
Got it. My niece goes there. Not to she goes to she's in the English in a language arts, I believe, program. I could be saying that wrong, because if she listens to this, she goes, "What are you talking about? I'm a science major." I'm going to get that totally wrong. But she says it's wonderful. That sounds like a really, really interesting place to migrate from. Missouri. Is that the first place you went, or did you go first Dartmouth?
Yeah, spent some time in Boston, then also spent some time in New Hampshire for Dartmouth, and then came back to California. San Diego's a really interesting place. I mean, in one hand, when you say it to most people, you obviously get the images of beaches, cruise ships. You know, it's a tourist destination. I think what a lot of people don't realize is just exactly how many Nobel Prize winners live here. Like, it is an insane mecca of technology.
No kidding.
But you know, research in biology, chemistry, genomics, digital health. It is, you know, and it continues to attract all of this top talent, you know, and there are very big companies doing things that are cool in the space. Everything from like Qualcomm to, you know, genomics companies doing cutting edge stuff with precision medicine. So it's a really cool place. It's just user friendly enough, to where you can pick up the phone or send an email to somebody that you don't really know but you want to know, and probably get a response. So it's I like, you know, it was, I didn't really know that coming in. You know, I thought, you know, we all kind of naturally think that Silicon Valley is kind of the paragon of that kind of environment, and it is. In honesty, it is in some ways. But San Diego's kind of a nice compromise because the weather's really good. Everyone's happy when it's
kind of chill. Yeah, everyone's.
Yeah.
So wait, is why would you say that is? Is it because of the education, the academia that's in that area, or Silicon Valley, or why do you think there are so many really front runners in technology and science there?
They tolerate weirdos. Okay, let me explain.
San Diego tolerates weirdos,
and so Silicon Valley. That probably needs some explanation. What I mean is, if you're and I mean weirdo in the nicest way, in the way okay, I would say I'm a little bit of a weirdo.
I'll go with that.
If you want to really push the needle on things in any field, right? So obviously you need to come from a foundation of strong confidence. When you don't, you start making things up. We're seeing that now with Elizabeth Holmes.
Yes. Oh my gosh.
She didn't have that strong foundation. A lot of made up things, and then lots of people get hurt. Blah blah blah. We know how that story ended. But and there's good lessons to be learned there. But what I mean is, if you're really trying to push the needle in some place, like, you need people who are going to think a little bit differently. Like, to them, they just see the world differently. They're kind of in their own world. I think you know we when I'm saying this, probably your listeners can already think of a few people they know like this. They just wear different clothes and they don't care. Like, they don't care what you think about that. They think it's cool, and that's enough for them. That kind of attitude, in a lot of ways, translates to pushing ways of thought in certain fields, whether it's genomics or digital health, or it's like, hey, why do we have to go to a hospital to get care? Why don't we bring the hospital to people's homes using these portable sensors? That's a different way of thinking. And you need people who are comfortable thinking in those different ways to get things done, or to lead organizations and convince people that's the right way to think and we should try it. Some geographical places, when those people are welcome, right? So like this is where like the limitations of some places like, I don't know, Missouri, it's like that's
Mm-hmm.
not the best place for that. It is a place for that, but it's like San Francisco is a much better place for that, right? So
Mm-hmm.
Silicon Valley, there's a lot of crosstalk amongst people who are pushing the needle, thinking differently, and those conversations are welcome. You can go to a
Right.
meetup group on 3D depth cameras or whatever, and you're like, the next thing you know, companies are coming out of these things because people are just met up like, oh, we co-founded this startup to see if this could work, and we
Hmm.
could do motion tracking for physical therapy, whatever. I mean, that's where these things start. And
Hmm.
so there are these pockets of innovation like that. And I think that's really the key. It's not that there's like cool co-working space or there's a beach nearby or whatever. That stuff's a bonus. You
Yeah.
really need to welcome different ways of
Minds and
thinking.
yeah, different ways of thinking. Absolutely. I mean, and I would say that you moved, and I know this is a more recent development over the last few years, but you actually became really involved in and founded Motiv Health, which I'd love you to tell us about because it is a different way of thinking. We've gone through a few dialogues around it, and I have learned a great deal about it. But tell me how where did that um, wellspring or that idea come from?
Yeah. The interesting thing about motive, I think the problem is very familiar to all of us, and I'm just taking a different approach on how to solve it. And I want to focus my time and energy to solving this problem of prevention. The thing is, Sonia, when I look at the landscape of diseases that are affecting not just like the date of our death or our longevity, but just how we live, like if we
Hmm.
live well or not. So these
Hmm.
cluster of things that are affecting us. Cardiometabolic diseases are make up the biggest cluster in that list, right? So things like stroke, heart disease, vascular disease, problems with your metabolism, insulin handling, glucose. These are all driven by inflammation, like
Hmm.
this
Hmm.
chronic systemic inflammation. And this inflammation, it's not just inflammation, but it's there's other factors as well, but this is coming from lifestyle. And
Hmm.
so one thing we know as a medical community, and I think people intuitively know this too in 2022, it's like how you eat and sleep and exercise and control your stress and control anxiety, your attitude towards these stressors in your life, and these sorts of things, this mindset stuff is super important to whether you
Hmm.
develop these diseases, can manage them if you already have them, or even in some cases reverse them. So we're
Hmm.
looking at this fact that we've known for a while, that most of the stuff we're dying from is preventable. Not all of it, but most
Right.
of it. And you can
Right.
certainly delay it. Right? We know that. We have really good evidence for that. So then you take that fact and then you look at how we're doing healthcare in the United States, and there's just a humongous gap.
Sure.
So like the healthcare experience for most people is humiliating, horrible,
Hmm.
and you're subject to something like 12-minute visits with a physician who has
Hmm.
no training in the foundational therapy for these diseases. The foundational therapy for these diseases is lifestyle. Yet our healthcare system has been completely unable to deliver the most impactful types of therapy to treat the most impactful types of diseases. This is insane to me.
Right.
So, right?
They're designed to treat once you've already gotten incredibly sick, right? And not
That's right.
even necessarily treat. I'm sorry, that's not the right word. What would you call it? Suppress, or how would you describe? Just take medicine and just
Manage.
kind
I
of
think
manage
the word
at
we use
best.
is
Yeah.
manage it, which
Yeah.
manage it means, hey, you're stuck with this, take some pills and figure it out. And yes, we
Hmm.
should tell you something about eating better or whatever. So when I see that, it really bothers me. And I think, okay, this is a problem. And it's most of these decisions around these lifestyle things are not happening in the hospital or in your clinic visit. Right? Out of the
Hmm.
500,000 minutes in a year, most of these decisions are happening at home and at work. That's where health actually happens. And
Hmm.
that's exactly where we as physicians have not been traditionally good at getting to. Right?
Hmm.
The good news about this is that we don't. I think that health is a team sport, and keeping people
Okay.
healthy is something that should be done in a collaborative way with the patient at the center, and the other members of that team who we can pass the ball to are some people that we've just ignored or been siloed off from, and those are health coaches,
Hmm.
dietitians, personal trainers,
Hmm.
people who are really good at promoting the types of lifestyle behaviors that we know can prevent and better manage these conditions that people are getting and delay them from happening to a much later date in their lives. So, a better model, instead of treating these things reactively, we
Hmm.
thought, how do we apply and bring this kind of healthcare team to people where they need it the most at home in a way that's persuasive. And people have tried that, right? So I think
That's
we're
it.
in a
In the
very
way that's persuasive. I'm going to flag that because I have a question about that. Carry
yeah.
on.
Yeah, and not to poo-poo the entire healthcare system. If you look at what we're amazingly good at some things, absolutely miraculous. In 100 years, 100 years ago, if you told people, when you have a heart attack, most places in the United States, how rural you are or whatever, you can get your artery open in a cath lab table by a trained expert in 90 minutes, and they can save your life. That is an incredible achievement. In the same way that like the vaccines that we have now for COVID, incredible achievements. This is really we should celebrate these as the products of thousands of people that we don't know the names of over the years who brought cutting edge science technology and translated that to the healthcare system. But we're really good at those things, but we're not good at preventing disease and treating these. And that's why we have to think about this problem differently. And when I look at what's
Yeah.
been happening over the last couple of years, I'm actually really excited because there's a cultural shift. People are waking up to knowing like they're sick and tired of being sick. And they already, just whether their physicians don't understand this or healthcare insurance companies understand this, they understand that a lot of how they feel and their disease processes have a lot to do with how they sleep and exercise. And I have to convince physicians this is true. When I talk to normal people, they're like, yeah, obviously. They look at me like, why are you even telling me something I already know?
Right.
I'm already looking for guidance on this, right? So you have a culture now that's moving toward this thing like, I need to take care of this stuff, and I really care about it. They're investing in things by themselves that help them feel better. They want to see they don't care about necessarily just the weight on the scale or their LDL numbers. These are kind of esoteric things that we care about as physicians. They care about it's like, what can health do for me? How am I better at work or my relationships or my energy level or pursuing hobbies? So like making health relevant in those ways is what they care about. And then they also care about like, what's my heart attack risk? And I've had one already. I don't want to have one again. I hate taking
Well, this is okay.
meds.
Let me jump in with the persuasive thing here, okay? Because like we all know, or I've been told, and quote unquote, we all know we should take vitamins, or I should take vitamin D or something like that, right? And I believe it because somebody that I trust told me you should take vitamin D. And if I can't feel anything from the vitamin D, and I'm not really sure what it's doing, but I just heard that it's good, it's very hard to persuade me to continue to do that indefinitely because I can't. I mean, I'm just spending money on vitamin D, and I don't really know if it's doing anything good for me unless I can feel it, right? Yeah. And so, how do you persuade people to make change that they can't feel at first, such that they stay with that thought until they do start feeling change? And then obviously, once you do feel better, after you've lost 15 pounds and you can just get up the stairs easier, you're persuaded to continue. But how do you persuade people to start?
Yeah, there's several ways to think about this, but I think one way to start is to think about extrinsic and intrinsic motivators. But basically, let's look at people who are really healthy and who sustain it. So we all know, we all have friends like this, and we think they're probably crazy a little bit. Like they're so adamant about their time in general, and the time they put toward their eating. They're strict about their diets. They're the ones who don't want to have the dessert when we do when we're out. And you're like, how the heck are you doing this?
Yeah.
And it's easy to make fun of them, but they're actually they're like really happy with how they're living. They live very intentionally.
Yeah.
So, the way I think about it is, staying healthy like this is a skill. And what they've done is built a system for themselves that gives them results. And they've made health something that's not something they have to go do, but it's part of their core value. This is trainable. This is not all habits. And and when I say that, I mean, to a larger point, there's kind of a first generation of thought around the sustained health. How do we keep people so you don't have to yo-yo, then the weight doesn't come back? So that after 6 months of intensive therapy, that you're on a good track now and that you don't revert to your own self, your past self. Well, what we do know is that for most people, just giving them information doesn't help. So, and this is I think, one of the things we've learned that we intuitively know, but one of the things we've learned through research as well, especially when it comes to digital health devices that we all have access to now. So we live in a world where Pinterest has 4 billion recipes. There's, Apple, when Apple comes out with a fitness regimen, I'm like, well, great. How is that different from the other 30 million exercise videos that are on YouTube that are for free? So we live in a world where we have access to information on how to do things. We have all this stuff available to us. We kind of know what to do, but how do we actually like execute and get it done? Like, how do you stay motivated enough to do it? And that's where I think it's really hard to do alone. I don't think it can be done alone, except for a very small percentage of people. That small percentage of people are like those people who've already figured it out. They've sustained it. They have an athlete mentality. Like they figured out the mental models. What they're looking for is tactics. And those are the ones that have the Peloton at home, but they also are on like the real race bikes as well. They got a couple of those in the garage, right? They're pretty disciplined on it. They're looking for like, I have a body fat of 10%, get me to 8. And you're like, okay. And they're like, just tell me exactly what to do. I will follow it and I'll do it. And we all know these people. They're people who they don't understand how other people aren't doing it. They're like, you know what to do, just do it. What's the big deal? And you're
exactly.
like, I'm struggling here, right? So then there's that. I would say that's like 5% of people. Then there's the other 5%. The other 5% are just not in the contemplative phase of change. If you think about stages of change, the trans-theoretical model, it's like they're pre-contemplative. They're just not ready. They're the smokers who don't want to quit yet. And to force them to do that is going to make them double down most likely. And they're not ready. And when they are ready, so there's this big 90% chunk.
Yeah.
And this 90% chunk, they need a couple things. First, they need a support structure that's not just them.
Yeah.
Like there's something about coaching that's like an intrinsic thing about the human condition, right? Like it's really hard to coach yourself. That 5% seems to have figured it out, but it's really hard for everyone else to. So it's like, don't try. Get help to do it.
Yeah.
And when you do get that help, what we found in our approach to providing that support is we've noticed that these functional outcomes are important. So we take a lot of time to figure out what those relevant things are to you. So when you're taking that vitamin D, why are you taking it? What did you want from it? Like, why did you take it when you were told to? We would actually drill down so deep into that your thought process. When you do that, you come out with, well, we call them captivators, captivating motivators. It's like these captivating reasons that people want to change. And when you take the time to figure out with somebody to get to know them well enough, you can extract these through structured conversations like motivational interviewing and so on and so forth. It takes some training to get this. But it's fascinating what people say. And these are reasons that just are different for everybody. You want to see a good example as a parent, and you want to have your kids eat well, and you feel bad as a mom. We've had that as one of our clients. Other people, they want to learn a new hobby. Other people, they want to be able to travel, and they're just embarrassed. They don't want to travel when they're looking or feeling a certain way. These things are all different for everybody. The second set of information we get is what their starting points are and what their barriers are. So it's like, we'll meet you where you are. Like, we get that if you're 300 pounds or 400 pounds, you're not looking to run a marathon tomorrow. And that's not what we're helping you do. For you, maybe the goal needs to be just to walk for 5 minutes. Right? So meet people where they are, figure out what it is that are the logistical barriers. And then their thought process barriers. The third thing we get, and this is the tricky piece, is that we try to match based on their profile what behavior change techniques work for them. And there are a number of these different persuasive methodologies that you can use that can work. And everyone's a little different. So some people are more, for example, competitive. Whereas other people don't want anything to do with that. They're like, I'm not competitive. That makes me feel more anxious. I'm actually more collaborative. I like to collaborate with people and do group things together. And it's more supportive for me. Like me personally, I hate that. I'm more competitive.
Yeah, but I'm with you, Ravi.
figuring, you can imagine that I've said the word taking the time. You can imagine already I've described things that take a lot of time and that is outside what the current healthcare system can do, right? In your 15-minute clinic visit. But it takes a week. It takes a month to figure this out. And once we figure out those 3 kind of core principles, now we have a fingerprint, a unique set of information that describes what's driving you, why do you want to do these changes, really deep down, what kind of techniques work on you, and where are you starting from, and what are your barriers. Then that's when we start doing kind of our structured coaching. And what makes things persuasive is that we incorporate those captivators into our messaging and into our plan so that we're linking things that you care about to something as small as taking that vitamin D. And so you're like, oh, there's a meaning behind this.
Right.
It's intentional. You're doing it for a reason. And once you start training your mind in that way, we've seen results.
Oh, sure. I mean, the approach that you have developed is stunning, and everyone should have it. In fact, I just think that Western medicine, for the most part, should just switch gears and start back at the beginning and start working with everybody who's sick. And some health insurances do that or try to do that, where they assign you a health coach, and they, if you get points if you lose a few pounds or quit smoking, and they try to do a little bit of that. But my curiosity is there any type of clientele that you find are virtually uncoachable, or like when you get this group of people, all the red flags come up and you go, oh my gosh, this is going to be a tough one?
I think you have to be in the right phase of change to be coached. Now, behavior change for healthcare is a very skewed data set. A lot of people who are behavior change scientists have been trying, very well intentioned, been trying this for a long time. When you look at studies that have been done that show like either some success, marginal success, not sustained versus sustained success when you're looking at outcomes like weight loss, blood pressure, how people feel, their self-efficacy, you look, they're pretty sparse, because they're kind of still sticking it into the traditional healthcare model. Like, they can't leave that model of like, you will have a couple phone calls with them every week, or one phone call every 2 weeks or 3 weeks. And because when you're doing a clinical trial, it's like, that's what you can kind of afford to do, right? That seems reasonable. And then they're like, well, people didn't sustain more than 5 pounds of weight. I'm like, I'm not, and I'm thinking, when we were looking at these studies, I was thinking, hold on, if you had Oprah's bank account and you could have those people live with you, you're damn sure you'd be in the best shape of your life in 6 months, right? So like, if you're a celebrity and if you're Chris Hemsworth, you're trying to get to play Thor in the next Thor movie, it's like, he's in shape, right? And he's got all those things working for him. He's set up a system where he can afford a system for success. If that means like a personal trainer living with you, then that's what you do. So are any of us doubting that 95% of us, if we had access to those types of resources, we would be in better shape in 3 months than where we started from?
100%.
We would agree with that. So I think there is some group that just isn't ready for that yet. And I wouldn't say they're not coachable. They're just not ready for that level of behavior change. And that's okay. I think that people transition through these changes in their lives. And I don't think anyone's not coachable. I think that we have the right way to reach them. This is what bothers me a lot about like this current conversation, just to shift gears a little bit on topics, but something similar on the vaccination campaign that we have. It's like, I see a lot of making fun of people who aren't vaccinated. And when I think as a physician, I'm like, hold on, we as a healthcare community need to own our failure here. It's like, no, we need to reach those people. And then calling them dumb is not going to be the answer, right? So it's like, in the same way that people who are like 400 pounds or 300 pounds, they're not just lazy and dumb. Like, no, they have real barriers, challenges. They need help. And like at our company, at Motiv, like one of the things we always like to say is, we fundamentally believe in the power of people collaborating together. Like, I fundamentally believe in history, that is like the reason, that's like the thing that humans can do that other species can't do, right? Like Yuval Harari talks about this in Sapiens, right? He's like, you don't see chimpanzees creating, dolphins are smart, but they're not weaving together nets, creating a tuna company and trading on NASDAQ and bartering with like the fishermen, right? They can't seem to mount that kind of collaboration. Humans can. And I think when you start collaborating with people in an intimate way like this, you do get to see results.
How do you think that you can make is from your company's perspective? Do you just have to wait until somebody is coachable, or is there anything that you can do to inspire the desire to change?
Right. I think one of our things that we do to inspire is to talk about what health means to you. It's like, what are you actually trying to get after? And that seems to resonate with people, because some people, and we actually try to actively discourage just I think there's almost an unhealthy, it's getting to this unhealthy obsession with weight loss. And I think that could actually, in some cases, lead to more eating disorders. I'm trying to shift the focus, and our company's trying to shift the focus with like, let's focus on overall health. What would your life look like if you spent the next week, more days than not, doing better health behaviors and sleep, exercise, nutrition, and mindset? And it's like overall health, the weight loss will come along for the ride. What people really talk about when they say weight loss is what they're usually referring to as fat loss. They want fat loss. And fat loss comes from better insulin dynamics and handling, and your metabolism getting up to speed in the way it should. And that it's like those things will come. So when I see like some of our competitors have some really weird, they're trying to get like the clickbaity titles like lose 10 pounds, the next whatever. And I'm like, that worries me. And I'm like, and they're like, hey, 10 minutes a day don't exercise. I'm like, I think when I look at people's lives, I think like everyone listening to your podcast right now, every single person is really good at something. something that I'm not good at or you're good at, something. What they do for work or what they do for hobby.
Yeah.
And I'm sure they would admit that getting to that level took more than 10 minutes a day, or it took focused practice and some guidance. And it took
desire. It took drive and desire, right? I mean, you obviously got to where you are because I could never get to the academia, nor do I want to level that you are, because it's just, to me, that was just not strong enough of a desire. And it was so hard. It was just really hard. Could I do it? I probably could do it. I mean, I'm not unintelligent. It's just, that's not where my drive was. And so, but my question is, if you have a 400-pound person and they're just, they in the back of their mind, they know they want change, but they just can't, where's that switch flip where they go, you know what, I'm ready. How do we motivate that person from just feeling generally unsatisfied with life, but not, making that decision to change it?
They're basically in a vicious cycle. We need to reboot them into a virtuous cycle of behaviors. Right? They're either like at rock bottom, or they'll come to this point where they know, they're like, I've just had enough. Like, I'm not hitting my goals. I can't sit here and Netflix and chill every day. It's not, and when they do, it's like, well, what is it you really want? And they'll be like, well, I want to lose weight. I'm like, no. What is it you really want? Right. And it's that if we inspire or push in any way, it's only to get functional outcomes out of people. Once I get those from you, I have a much better idea of how to drive you. Like, there's this big goal at the end. And we're going to, when you're like our first program, our coaching program is called Daytona. And with Daytona, what we do is we work backwards from getting to this big goal. Yeah. Here are the non-overwhelming steps you have to take, right? So it's like the next month, we're just going to focus on these small changes. We're going to nudge you using the information you gave us, and we'll start creating mastery. And it just takes small incremental steps over time. And that's frustrating for most people in their health. And we always just remind them, like, well, how did you get good at being a lawyer? Small incremental steps of mastery over time. So it's like a lot of people, this is a behavior change thing. We call it strength highlighting. It's a lot of people are really good at something. Yeah. And so they already know that this is true. It's just they haven't been able to apply this system of values to their health. And and to me, I'm like, that's teachable. When you're born, like, you're not automatically supposed to know how to be healthy. It's like a skill. It's like if you want to play piano, you get a coach, right? You learn how to sell. And when you look at like really high performers, like NBA or Olympians or whatever, those people are in that 5%, like the athlete mentality. But like, it's interesting. They get more coaching the better they get, right? Like, we would never, like, LeBron would never go, oh yeah, I'm done now, I'm good enough. Like, he'd be like, no, give me more coaching. I need more coaching. Yeah. And it's like, we don't treat our health that way. And I think we should start treating it that way. So probably
with an underlying sense of shame that you should know how to do this, right? Like, I certainly look at people around me who are healthy, like my husband, naturally just never, I don't think he's changed a pound since he was 18, except for when he was training for marathons, he lost a little weight and, that kind of came back. And you look at it and go, they're just born that way. They're just naturally healthy. And there are certainly some people, a very small group of people, who aren't working that hard and they just naturally are sleep well and eat well and do that sort of thing. And I think there's some shame in the sense that, I should be able to do that. I should naturally be that way. There's something wrong with me. And then coming to the table and asking for coaching implies, or it includes admitting guilt. Like, I can't do this on my own. That's a very hard thing. For me, my hubris on that front can be quite hard. Once I learned that coaching is awesome, and I have a life coach and a business coach and a leadership coach, and for my staff, it's absolutely life-changing. Coaching is absolutely life-changing, and there's no shame in it.
I think you're absolutely right. I think, framing things is really important for people, how they view a factor or an idea in context of their other framework of ideas. So when we reframe that, it makes a big difference. So it's like, some people, it's like you take that shame away by saying, we're not like fixing, we're leveling you up. Like, you're already good. You are worth it. This is like, when people are worried about obesity and fat shame, I'm like, when I see somebody who's really frustrated with their weight, and I used to be as well. So I'm in this group as well. I know what it's like. And it's like, I'm not dumb. Why can't I figure this out? Like, I'm a physician. I've gotten some accolades in my life. Why can't I get this part to work? And I think it's like I stopped seeing it like I'm broke and need to be fixed. I'm like, oh, it's just like anything else. I just need to level my skill set up to the next level. Well, how would I do that if I was a physician or I was trying to learn a new procedure or how to use a new, I would go to a conference, take a class, whatever. Those things I would do in the same way. It's like, let's level you up. Like you're getting some results in life when it comes to work and these things. Let's get to the next results and let's make sure we measure the things correctly. So now we're not just measuring weight, measuring those functional outcomes.
Yeah, it's the whole. Yeah.
We don't like to talk about this part of weight loss and fitness, but I think we need to talk about it. It's like self-efficacy matter. Like what you really want to do. It's not just about food islands and it's poor people can't afford health. It's like no, those are policy issues that we definitely need to address. Like no one solution. Like Motiv Health is not going to be the end-all be-all solution for people's prevention for sure. It has to be in concert with a number of other things working together. But I would say if I had to choose one thing as an outcome, it's self-efficacy. When you feel like you have some more agency and you can make a difference and have some control over your health destiny and how you feel, that is a very empowering feeling. And that is something that you can continue to use and feed off of even when your coaching is done or you don't want to coach anymore. So that's like something.
It's like a tool. You got a magic wand. It's in your pocket and you can use it for the rest of your life. Well, this has been a fantastic conversation. You're brilliant beyond all reason, and I've really enjoyed talking with you. And I'm definitely gonna.
It's not just me; it's my team.
Well, and actually, speaking of which, where can people find you? Where can people look you up if they want to learn more about this? Get in touch with your team. What's your what
we do? We're kind of a little bit in semi-stealth, I would say, but motivhealth.io is a website. We have a waiting list that we can sign up on. Also, happy to take feel free to reach out to me. I'm on Twitter at Ravi Komatireddy, and I am Ravi at motivhealth.io. Happy to take emails directly. We're starting currently a very private beta.
Yes.
And it's not for everybody just yet, but we're really trying to bring together everything I talked about into one cohesive package to help people on their health journeys over the course of months, using some of the principles I talked about and some others as well. So if people are interested, would love to have a conversation.
Get on that waiting list. Get on that list to learn more.
Yeah.
And you know what? I'll put all that information into our podcast page as well, so people can actually link to you and learn more. I am thrilled. I know that I'm going to be one of those people that's going to get to work with you down the road here. And thank you so much for taking the time to chat with me today. Actually, I could probably talk to you for like 2 to 3 hours easily.
No, thank you for the opportunity to share the vision. I love talking about this because we're really passionate about it. Not just me, but all of our team members are really passionate about
it.
Love it. So we care. We think this is the future of what healthcare should be. And it's like something we want for our kids and our grandkids. So thank you for having me on.
Cheers. Thanks, Ravi.
Thanks for listening to It's Not Just Business Talks with Sonja, a real-life podcast to inspire you. We'll see you again next time, and if this is your jam, click subscribe to get future episodes.